Today we are going to do perineal care. The purpose of this procedure is to remove secretions and provide comfort, and to prevent or eliminate infection, odor, and promote healing. The materials needed are bath towel, gloves, washcloth, clean wipes, perineal pad, and warm water. Perform hand washing or hand hygiene. Gather the materials needed. Introduce self and verify client's identity. Explain to the client what will be done, why is it necessary, and how he can help or cooperate during the procedure. Provide client's privacy by drawing the curtains around the bed or closing the door of the room. Fold the top linen to the foot of the bed and fold the gown up to expose the genital area. And place a bath towel under the client's hips. Position and drape the client and clean the upper inner thighs. Position the client in a back-lying position with knees flexed and spread well apart. Cover her body and legs with a bath blanket position so a corner is at her head, the opposite corner at her feet, and the other two on the sides. Drape the legs by tucking the bottom corners of the bath blanket under the inner sides of the legs. Apply gloves. Wash and dry the upper inner thighs. For female clients, clean the labia majora. Then spread the labia to wash the folds between the labia majora and the labia minora. Use separate quarters of the washcloth for each stroke and wipe from the pubis to the rectum. For menstruating women and clients with indwelling catheter, use clean wipes. Use a clean wipe for each stroke. Rinse the area well. Place the client on a bedpan and pour warm water over the area. Dry the perineum thoroughly, paying particular attention to the folds between the labia. For male clients, position the client in a supine position with knees slightly flexed and hips slightly externally rotated. Apply gloves and wash and dry the upper inner thighs. Wash and dry the penis using firm strokes. the client is uncircumcised, retract the foreskin to expose the glans penis for cleaning. Replace the foreskin after cleaning the glans penis. Wash and dry the scrotum. The posterior folds of the scrotum needs to be cleaned when the buttocks are clean. Inspect perineal orifices for intactness. Inspect particularly around the urethra in clients with indwelling catheters. Clean between the buttocks. Assist the client to turn onto the side facing away from you. Pay particular attention to the anal area and posterior folds of the scrotum in males. Clean the anus with toilet tissue before washing it. Dry the area well. For post-delivery or menstruating females, apply perineal pad as needed from front to back. Do aftercare of the materials used. Remove and discard gloves. Perform hand hygiene and document the procedure done.